Choosing a healthcare provider to care for you and your baby during your pregnancy is a big decision. And in recent years, midwives have become a popular alternative for women. Luz Birth and Health Center, located in Albuquerque, is dedicated to providing compassionate and holistic prenatal care, women's health services, and a safe alternative to hospital birth for women and their families. And joining us this morning from Luz is certified nurse, midwife, and co-founder Abigail Lanin Eaves. And we are so happy to have you with us today.
Thank you.
Thanks for being here.
Thank you.
Well, you know, I want you to first, before we go into anything, explain the difference between a midwife and an obstetrician.
Okay. So midwives are trained in normal care of pregnancy and birth. So we really focus on disease prevention and health promotion and supporting women in physiologic birth. So encouraging them to stand up, move around, those sorts of things, and looking at pregnancy and birth as a normal life event. Physicians also very much do that, but they're also trained to deal with the illness aspect. And some physicians do often view pregnancy as an illness, and it's not.
Wow, I'm surprised to hear that.
Yeah, and it depends on where you are in the country or if you're in a hospital-based practice. But I also want to say that our physician consultation and collaboration is very, very important to us, and we have very good relationships with physicians in the community.
That's important to know. So tell us a little bit about the pregnancy care that you offer.
So we take care of women throughout all of their pregnancy, their prenatal care, their labor, birth, postpartum, so their after birth, and the newborn care as well.
Oh, that's important.
Yeah, and we do long prenatal visits. We have hour and half-hour prenatal visits, and many women in hospital-based practices get 10, 15 minutes at most with a provider.
Well, I would imagine for first-time mothers, this is especially significant because they just don't know what to do once they've had the baby. That extra care is so important. So who actually provides the care then in the birth center?
In our birth center, we have certified nurse midwives. So we're bachelor's and master's prepared nurses with a concentration in midwifery. They're also licensed or certified professional midwives who often do home birth and also practice in birth centers, and they train through apprenticeship programs. And we're both really believe in, again, the natural process of labor and birth, and one is not better than the other by any stretch.
Right, it's just what's right for you personally. So
Absolutely.
who would be eligible then for the birth center care?
So women who are low risk are eligible for birth center care. So women who are diabetics and on medication are not eligible. Women with hypertensive disorders are not eligible, and other medical disorders, you know, heart defects or things like that. But women who have had a previous C-section can have their babies in our birth center. Women who are diet-controlled diabetics. And there are lots of other things that are not necessarily considered high risk that can still come to the birth center.
Great. And of course, all the details on the screen right now on how you can contact Luz and also how you can find them, the number to call on your screen right now, and we'll of course have those details for you on casa.com. Thank you so much for joining us, and thanks for all you do for all the new mommies out there.
I appreciate it.